wore out. So if we want to restore a joint, all we need to do is wear out a little slower and grow it a little faster. And as long as we get that balance right, you can restore cartilage in a joint. So what can we do? For knees, glucosamine. Glucosamine by mouth, if you take a brand that works really well. If you take a brand that doesn't work, it doesn't work. So if you're taking glucosamine for your knees for 2 months, either that brand doesn't work if you're not any better, or your pain isn't coming from your knee joint. We can also, for any other joint in the body, glucosamine by mouth isn't going to work. Glucosamine has to go either by needle and injected into the joint, or in a cream and through your skin, which we call transdermal. And so we have a glucosamine formula that works really well from your jaw to your big toe and helps restore joints. And you need that every single day to repair from wear and tear. What do we do for joint pain? We give it ibuprofen, we give it non-steroidal anti-inflammatory medicines, which stop or slow down cartilage repair. They block glycosaminoglycan synthesis, and you can't rebuild cartilage if you take those drugs.
We got these infrared lasers and
infrared lasers are fun.
Red lasers, like this Dr. Fred Kahn made this, or I mean they're everywhere now. But
I've had one
since
since.
Up in Toronto.
I've had infrared light in my office since 1990.
They're awesome, aren't they?
I use it a lot.
Yeah.
And if we use platelet-rich plasma, we always use it. And we use it to restore nerves and restore sensation, and it's amazing in many ways.
Yeah, because he's had a lot of success with sports injuries and
Yep.
all kinds of things. So.
It won't do what that nitrous oxide
No.
gas won't, and it won't do what the platelet-rich plasma and stem
Right.
cells will do.
But it does.
But it does.
In a sense,
Yes.
help in those. Factors.
Yes, it does.
Right.
We can also inject platelet-rich plasma and stem cells into any joint, and they also will regrow cartilage. Testimony from the little lady in the back. Friday, she got her shoulder injected with abdominal fat from liposuction and platelet-rich plasma for a shoulder that's not doing well. And Saturday, you want to talk about your, yeah, come on, come. This is how high show us how high you could get before we did this. Just looking at your arm. Can you come in where people can see you? This was done last Friday. Saturday she woke up without pain in her shoulder.
This was about it. Well, without pain, this was about it. Now I can. Yes.
That was last Friday.
Because actually I'm probably overusing it and have to let it heal. But still, this is to me amazing. It's been this way as long as I can remember.
What treatment is this?
I put stem cells from abdominal fat
from
and
here.
liposuction and platelet-rich plasma taken from a vein into her shoulder. So that's amazing. Now, she did not grow cartilage that fast, but the fat has lubricated her joint and really helped her out of pain that fast, and the cartilage will grow with time. And yes, there was ozonated oxygen in that joint right afterwards. I don't put anything in a joint without also adding ozonated oxygen, because it will kill things that are in the joint that you don't want, and it will minimize our risk of infection, which is the most dangerous thing when you put a needle into a joint.
Amen.
So, the parts of your question I haven't answered yet. Did I get to some of them?
Well, yeah. Actually, it's really a combination is what you're doing. So.
I do a combination. And so whatever tissue needs it, and whatever your resources can provide, we work to the limitations of that to see what it is that you need. And when we do something that's really successful, that's great. And if we do something that's not as successful as we want, that's information that helps us figure out what needs to be done next. So either way, we win. And it works pretty well.
What about tendons?
That's what we're talking, when we talked about a rotator cuff tendon.
Yeah.
So let's go back to that. You have a partial tendon tear. So that means your rotator cuff tendon that used to look like this, or the tendon in your arm, or any other tendon, is now either looking like this, or that, or this. The orthopedic surgeon for your rotator cuff is going to cut this out. Cut back far enough to get to reasonably healthy tissue, and drag that over and anchor it to the bone. That's rotator cuff surgery. Now you have all the pain of that procedure, and you have the physical therapy to get this to stretch out afterwards, is what happens after your surgery.
When you have a tighter shoulder and you have scar tissue that's pinching nerves,
Meanwhile, back in Wayne Manor, we can take blood out of your arm, spin it down and concentrate your growth factors, inject them into this tendon, and in 4 weeks you'll grow some of this back. And in 8 weeks you'll grow even more of it back. And if you're not one and done, you're one and better, and maybe it'll take 2 and done. And
Holy
some people
ozone,
have taken
Batman.
3. Pardon?
Holy ozone, Batman.
That's right, and we put the ozone in right afterwards. Because what we found in platelet-rich plasma is that the pain you would otherwise have 4 days later goes away in a day if I have the ozone. That's amazing how fast that works. And with this, we combine nutrition, because you need to know the do not eat list. You need to know what foods inflame your body that you need to take out. If you wake up with a stiff neck in the morning, it does not come from the pillow. It does not come from the open window. Your stiff neck in the morning came from last night's pizza. And you ate something on your do not eat list that inflamed your injuries and lit them up like a Christmas tree. And so the do not eat list is wheat, sugar, potatoes, fruit juice, hydrogenated fat and fake food, and dairy from cow. Generally in that order.
It's a real short list.
It's a real, yes. You can still eat chicken, fish, turkey, steak, vegetables, rice, and real food. But that is going to make you hurt. And so people come in and they go, oh, all this good stuff I can't, do you know how lucky you are you can't eat that? I mean, all these people and all your friends that are still putting weed killer and Roundup in their body and poisoning their children and killing their families, so to speak, which, you know, Roundup has just been labeled as a carcinogen in California.
Finally.
It's not that off the wall to say that's what is happening in our world. And every time you eat it, you get a stiff neck and pain, and you've learned not to eat it anymore. And you sit around at the table while everybody else at Thanksgiving eats the stuffing and the pie and the ice cream and falls asleep afterwards. It's not the turkey, it's the stuffing and the pie and all the other, and the macaroni and cheese that made you go to sleep. And everybody else is asleep and you're still wide awake. And then look around at the table at all the other diseases and medicines everybody else is taking and realize you've just written yourself out of that equation as much as you possibly can.
Is that a histamine response in the food, basically, that causes all the swelling? And there's a lot of foods that I was told in my diet that to stay away from. And it was
The
like
question is
corn,
about histamine.
spinach, yeah.
Corn isn't real food. So yeah,
There you
corn's
go.
on the list
So-
too.
so-
But corn doesn't make you hurt unless you're sensitive to
To
that.
the histamine.
The list I gave you seems to be universal to our species.
I was just.
And then every person might have an additional part to their
That's
list.
what I wanted.
What was it after fruit juice?
Wheat, sugar, potatoes, fruit juice, artificial sweeteners, hydrogenated fat. I didn't mention artificial sweeteners before. And fake food and dairy from cow.
Do you include GMOs as fake food?
Yes, I do include GMOs as fake food. I have
So
no
that's-
belief that that's safe for us to eat.
So that's soy and corn.
Soy, corn, sugar beets, unless labeled organic.
Soybeans.
Yes, soybeans are genetically modified unless labeled organic, to the best of my knowledge.
So all that stuff about breastfed, and still, that's no good, you know?
Breastfed for babies is...
Grass.
Grass-fed, oh yeah. If you listen to breastfed cows, yeah, thank you. Mike. See, I'm sitting in the back.
It doesn't say breastfed.
Mark
organic.
Hyman speaks in his talks and says that grass-fed beef is as heart-healthy as ocean-caught fish. And I don't disagree with that, because the data is showing that heart disease is not affected by grass-fed beef. That's pretty strong. And so that's the way I eat too.
A moment ago when you said, when you were looking at the stiff neck, do you mean also, or do you mean a crick in the neck as some people say?
That crick in the neck that you think is a pinched nerve, and you go to your doctor and they treat you, and they're wonderful doctors because it goes away in 3 weeks, and they fixed your pinched nerve. The food reaction from that pizza that made your stiff neck lasts 3 weeks. And
What
I don't
about,
know if your treatment made a whole lot of difference.
what about hydration now?
Hydration is important. Drinking enough water to detoxify your body is really important. Let's talk about leg swelling. How many people you know whose legs swell? Okay? And As we get older, we tend to...
More edema or more?
Edema and leg swelling. Why do legs swell? And how many people do you know that have these legs swelling and they have no cardiac issues? Because we're always taught diuretics, get rid of the
That
water.
was the other thing I was gonna ask you, are they set over 70 on blood pressure medication or have a pacemaker?
And,
But 90% of those people have leg swelling.
and a lot of other people that don't even have that have leg swelling. So let me talk about what really makes legs swell and why do we really have that edema. And it's the same answer for why does an ankle swell when you sprain it. It doesn't swell. Here's why it swells. For the person with leg swelling, if you touch their legs and feel them, they're really, really tight. And remember how we talked about the toxicity of a muscle that's knotted and held really tight, and how we're using a way to expand that so we can restore blood flow to the muscle? So when you're using this muscle and it's really tight and it doesn't get enough blood flow to clean itself out, it gets really toxic. And the fibroblast cells that hook and connect to each other with multiple tentacles, they unhook and they separate and they suck fluid out of your veins and make your legs swell or make your ankle swell. There is so much healing metabolism in that ankle that in order to keep it less toxic, the solution to pollution is dilution. So your body dilutes your poisons and you see that dilution as swelling. So if you want to get the swelling to come out of the legs, you need to detoxify the muscles. That's not something you take by mouth. It's something you do with your hands, as Art would tell you.
One movement.
You get your hands into that muscle and you make it release those toxins. You put your hands into your leg and you get into this muscle and very, very slowly with a lot of pressure, you squeeze the stuff out along the line. You do 3 lines twice a day or 2 lines 3 times a day, you'll find it's a different leg in 2 weeks. And it may take you a month, you might be that toxic. So how do you treat an ankle sprain? We're all taught ice, rest, anti-inflammatory drugs, right? We've all heard that? So what happens when you sprain your ankle? What does your body do to that ankle? Makes it swell. We all just talked about that. Makes it hurt, so you stay off it. And does it warm it up or cool it down?
Heat.
It warms it up. Why does it warm it up? What does warming up an injury do for it?
Circulation.
It increases circulation, speeds up metabolism, and speeds up healing. Right. We put ice on it. We take anti-inflammatory drugs. We've just stopped or greatly slowed down our healing response. Why would we ever want to do that? Because we're going to stop the swelling and stop it from hurting? Nonsense. It's not going to hurt any more with ice than it does with heat, or any less or any more, and you'll find that heat is more comfortable. So go home, prop it up, put an ACE bandage on it. So as fast as the blood can go in to deliver, you squeeze the stuff that's used up out so it doesn't have to swell as much. And you keep circulation with new nutrients going even faster and heat it up, even more than the body can do. Put heat on it, and it will heal even faster. And you'll find this ankle that otherwise would be painful still in a week might be better in 3 days. That's a way different way to treat injuries. And the underlying theme of that is, I've taken it, my approach is to think of medicine a different way. And if it doesn't make sense, why doesn't it make sense and what would make more sense? So I passed an examination recently. I'm now board certified in integrative medicine. Ta-da! I took the exam May 20th and found out last Wednesday night. So I wouldn't be the guy to give you your cholesterol medicine. I would be the guy to teach you how to not need it. I wouldn't be the guy to give you your diabetes medicine. I'd be the guy to teach you how to make your diabetes go away. And then my forte and specialty in that is healing injuries and making pain go away by healing the injury, not by making your nervous system not work. You've seen the advertisements on Lyrica? Lyrica helps pain. So let me talk about how Lyrica really works. The way you know you're injured is the nerve endings in between the strings of your fascia that measure pressure and friction. So if I put more pressure where they're already squished by a knot, it hurts, like you found out. And if I go 2 inches away, it doesn't hurt as much because those nerve endings are not pushed as hard as much. Lyrica works by making those nerve endings not work. Can I say that again? Lyrica works by making the nerve endings that are being pressured and injured not work, so you can't tell that's going on anymore. It doesn't make you better, but the drug company, pharmaceutical company, is allowed to say it treats pain because it makes your brain not feel that you're injured anymore. That's not healing. And while it makes these nerve endings not work, it makes this one not work, and you can't remember why you went downstairs. And what we're taught in medicine is to keep giving you more and raising your dose till you don't complain about your pain anymore, and we can say it's treating your pain and you're better.
Whole West medicine is like that.
A lot of Western medicine is treating symptoms. Isn't it more fun to look at the root cause?
And meanwhile, you're creating greater resistance, and you're also getting the side effects.
Yeah,
It gets more complicated as you do that. Yes?
Do you use, or what's your opinion on PEMF as sort of an
PEMF.
Yeah, pulsed electromagnetic field therapy.
Oh, pulsed electromagnetic field therapy. The body is electric, and the body runs on light energy, and the body runs on electricity energy. And with minimal, little teeny voltage changes is all it takes. So microcurrent stim, all kinds of electric things can be really, really helpful in putting energy into the body to help it. Let me introduce this book. Janet Travell and David Simons wrote a book on myofascial pain. It's 2 volumes. It's red. It was written starting in the early 1980s. And in the 1990s, I wrote to Williams and Wilkins and said I really wanted to write a book that people would understand with the same kind of information. And they said, we're not really interested in your project. So I had just bought my first notebook computer, and I sat down and I started to write this book. And 13 years later, we published it. And the book is a myofascial pain manual for people, so you can understand it. And it's got pictures in it and that show you about myofascial pain and what it is, and then that show you the pain patterns of which muscles cause pain in which parts of the body, and then a section on how do you use a rubber ball to massage those parts of the body to make those knots smaller. And as fast as you make the knots smaller, your pain is less. And then a chapter on how to stretch your body so that you can figure out how to get your fascia to loosen. And then a picture index that shows you where to look up your pain pattern and then where to go in the book to learn how to heal and work on it. And then a real index in the very back in case you want to look up something like tennis elbow and carpal tunnel syndrome. And there's a really nice section on carpal tunnel syndrome. It talks about why you get it and how to make it go away and what to do with that. Other questions before I go off on another tangent?
How would you handle a situation where it happens to be me? I had my sacrum dislocated by chiropractors, completely knocked out into left field. We're going to osteopaths now for a long time, and they've gotten me better, but I'm still suffering, I'm still dependent, and I don't feel the shift that I should. In other words, I can feel that my back and the lower part is all out of whack, just like I'm sitting here right now. I can feel
You are. You've got a twist.
Yes.
Yeah.
It's more than a twist. There's more to it, with the especially with the sacrum.
Right.
How would you handle something like that?
Look and see where you're tender.
I know
And
what
then- And if I find the same things that are tender, heal that and make it go away.
would that cause the bones to release?
It may allow the bones to release and not pull them back out of distortion, back into distortion. That's what we would hope for. But the pain may be coming more from how the fascia strings hold you together, and releasing that in this way may change the pain. And restoring the ligaments to your sacrum may help hold it in the place where it belongs. And all that is approachable.
Yes.
It is totally approachable. You'd know in your first visit if I'm touching the right spots. That's the key.
In a situation like that, where the condition has influenced a way of actually moving her body, so could the body keep re-injuring it by virtue of the fact that her body's kind of trained herself all this time?
Her body
to
may
compensate?
re-injure itself in its own pattern as she goes,
Right, well, it's
but
really not
she's
so
trying to
much-
struggle to get out of that pattern with this osteopathic work that she's doing.
Right, but
And if we
doesn't hold.
restoring the fascia where it's injured may be really helpful. Yeah, that might be the next step for what you need, as long as you're already gluten and dairy free. And if you're not, you am, then that's great. You're ready for this kind of work. If you get one of these books tonight, we give away one of the balls. So you get a ball for free when you buy a book. And then, could I have the golf ball crusher? It's in the bag by me.
There's 4 free seats down front, you guys.
I don't, oh, here it is. It's in pieces. So I brought a couple of these with me also, because these are really fun. You know, if you cut your finger, what do you do when you cut your finger? Do you hold it up in the air and watch the blood drip down your arm? Do you wait till tomorrow and see how it is, and if it's still bleeding, you go to the doctor? You take some ibuprofen and wait and see what happens? No, that's silly, right? You put your finger on it and you stop the blood. You have pain in your body. What do you do with it? Do you take some ibuprofen, see how you are in the morning? Do you wait till tomorrow and see what's going on? Or do you put your finger on it and stop the pain? Same thing. As silly as it sounds, same thing. And what's really interesting, if the pain is coming from the fascia and you take your hands and make that fascia loosen, whatever pain was coming from it is already different and you already know. And you don't have to wait till tomorrow. So everybody in the room can find your knots and push on them. And if you think you have lower back pain, you probably have some really tender knots in your butt. And if you take that rubber ball and put it on the butt and lean against the wall and play bear and squish those knots, you'll find your pain gets a whole lot better if that's the right answer. And how long does it last? Till those knots tighten back up again, which is dependent on what you ate and how weak your fascia is and how injured you are. If you want to squeeze these muscles up here, you got to squeeze them pretty hard sometimes. And you don't have a lot of finger strength. So we have what we call the golf ball crusher. Because these look like little golf balls and this crushing thing is really crushing. So how do you use that? Put this on these muscles and you give it a pull. And you can put a lot of pressure on that. And while you're putting, see how hard I'm pushing? I didn't used to be able to push this hard. This is what's normal. And then you turn and you pull the muscle through your grippers as you do it. And when you want to loosen your neck, you put it up here and you get your neck to loosen. And if you want to loosen your legs, you put it on the back of your leg and you pull against it. You can use these. I only brought 2 of them with me. Your back is the rubber ball, because the rubber ball goes on this muscle and you can go up and down against the wall and you can push as hard as you want.
I got one last time and it's really useful.
The rubber ball is really fun, isn't it?
Well, this thing.
You got one of, yeah, you did get one of these. It's been really fun.
It's useful.
The thigh, you would get your hands into, you would find this knot in this rope, get your hands into it, and physically make it stretch out. Fella comes into my office with pain in his feet. Anybody have pain in your feet?
Is this a joke?
No, it's not a joke. Fella comes into my office with pain in his feet. No, I'm not. You have pain.
I was at a water slide, and this is an old injury, and hit the bottom of the swimming pool as I was projecting out the end of the thing, and the bottom of my heel has hurt me for like, I can honestly.
So come sit up here.
And I have like rolled on that.
Come sit up here. He's got pain in his heel from an old water slide injury.
How old?
How old?
1994.
Okay, so sit down, let me just... I'm going to feel where his leg is tender. That's tender.
Yeah.
This is tender. That's a little less tender. That's not so tender. And this is tender,
Yeah.
right there. And then down in his heel. Down on the bottom. And And is it tender when I touch it? There. Yeah, right?
Yep.
Okay. Now let's see how tender this one is. I want you to get the feeling that this is a lot less tender.
I've known that for a long time.
What you haven't known, he said he's known for a long time that his
No,
right
but
calf.
I've rolled through all this, I mean,
So,
honestly,
Here's what to do for it. You want to see? Put your leg up on there. Come, Gavin. Yep, right on there. Let this fall out to the side. And then I'll do the first one and you do the second one. And then let's find out if we're lucky enough that your foot pain's already better. So this is bone and this is muscle. This is going to hurt a little bit. You're probably used to it. And very, very slowly, we're just going to make this stretch. And go all the way down to there. And then you'll do the second one. And then we'll see if your foot pain feels any different. And if your foot pain's coming from this, the part that's coming from this will be different that fast. All right, go ahead. From here down to there with both your thumbs, as hard as I did and not any faster. This is going to be tibialis posterior, medial gastroc, and flexor digitorum profundus. Nice word, isn't it? That means toe flexor. Just stay on it. And do you feel that it's already less tender than when I did it?
This is sort of
Yep.
Soleus too, yes.
That's already heel cord.
Yeah, that's right. I feel like I have a heel cord. Yeah.
And you probably do. If I want to feel your heel cord, check it out. It's got an injury right here.
How do you
A
get rid
little
of that?
injury right there.
How do you get rid of that?
Injury. Platelet-rich plasma, re-injure it, he'll go into heel cord. All right, so make nice to it now. Make nice to it. And stand up, take a few steps, and tell us if your calf's any different, or your foot's different.
I feel it like the way
But does that pain sensation feel a little different?
yeah.
All right,
I
so,
do that a lot to myself, Doc.
yes.
I,
So if you could make this looser like this one is, that pain might not be there. That's what we're talking about.
yeah, even at the site of the injury. where-
Even at the site of the injury, yes.
where it
And
feels
if
so
this
hard
needs it,
there.
then this will be platelet-rich plasma, but this gets treated first. So why don't you go home and do 2 lines, 2 or 3 times a day, just like we did, and see what happens to that. And then take this tendon, take this one here, and do the same thing right along there. But here, this one drives it. You won't loosen the foot without loosening the calf. So my point is, if you think that's what's causing the pain, like I do, or you look it up in the book that that's causing the pain that you think is in your foot, and you do something like that, if it's the right answer, the pain's already better.
So you're
That's
saying-
all it took. That's what I mean. You don't wait for the bleeding to stop. You put your finger on it and make it go away. Your
So-
headache can respond the same way.
So you're saying if he can't resolve it by treating it, with that therapy for a number of days, then maybe PRP would be useful?
Depending on where he's tender. And if he's tender where he attaches, that's going to be PRP. If he's more tender where the muscle is, we'll start with trigger
Start
point
with trigger
injections of
point.
nitrous oxide gas. And I will almost always start with that. Because if I can change this muscle to change this pain, and I don't have to charge you money to take blood and do a bigger procedure, I'd rather do it less.
I'd rather shoot the nitrous out gas in.
Because unless I make your calf loose, no matter what I do to your heel, it's still going to hurt because the pain in your heel may not be coming from there.
Okay, I don't mean to take up everybody's time, but I've had tinnitus for 7 years. That's
Yeah.
one of the most insidious things.
Tinnitus is one of the more difficult things to tackle, but tinnitus can come from tight muscles in the neck and jaw and face. So if I touch your face,
Or skull, out of place, or,
I'm going to be more looking at the face.
okay.
And if I find the muscles in one side more tender than the other side, I'm going after the ones that are tender and see if that makes things change.
All right.
Just like I did with the legs.
It's the same thing here with the whole collarbone
The whole-
base,
yes.
the leg.
And all that fascia tore when you,
Sternocleidomastoid, I mean, the whole thing.
and all that fascia tore when you got injured.
Yeah.
And it's still there and still injured and hasn't repaired
That's
any better
exactly
than it
right.
could.
No, it hasn't,
Right. It still needs to be repaired.
yeah.
Tinnitus can come from the muscles in your neck and jaw.
Also
even
come
shoulder.
from chemotherapy,
Yeah.
antibiotics.
There's all kinds of things. That's why it's so difficult to find. But if it's coming from a fascia injury, we have a chance to make it change that you may not have seen before. And what I'm trying to show everybody tonight is colors you've never seen, things you've never thought of.
What do you do about bunions?
What do I do about bunions? If the bunions are big and you need to correct a physical deformity, that's going to take a surgeon to do bunion surgery. If you have pain in the joint, I start with glucosamine cream and see if I can get the joint to relubricate and work well enough that you don't need to have the surgery if you don't want it. And sometimes the pain comes from the little muscles in between the foot bones. So you learn how to treat them the same way we did your leg. Or you put needles in them the same way. The biggest clue is where are you tender that you haven't healed from an injury that happened a long time ago. Where do these injuries happen? Jumping out of trees, jumping off swing sets. And how many of you guys jumped off an occasional roof? All right. And you remember the sting in the bottom of your feet because it was just PF Flyers, it wasn't Adidas. But you don't remember that you tweaked your hip tendons and weakened them.
Tore my labrum in my hip.
There you go. And then 30 years later, as your tissue becomes more fragile, now that's causing you pain. And now you go out and you lift too many bags of mulch, and you ate a pizza, and you blame it on the yard work. And you're going to hurt for 3 weeks.
It's all scar tissue, inflamed.
Your injuries light up and wake you up with pain when you eat food that inflames them.
But I'm a little confused about the tender spot versus the source of the injury, right? Because you're talking about go where you're tender, but also the source of that injury, if it's very old, it could be...
You don't necessarily need to treat everything that's ever been injured in your body to make something go away.
But there's an
You
order.
need to do enough, and there is an order, yes.
So how do you know the order of events?
30 years of experience of knowing what I feel in your body to know what to do first, second, and third. And 30 years of doing stuff that didn't work, and other stuff that did work, and learning the difference.
And all,
So that when
all
I-
the years you spent trying to get rid of it too.
Yeah, and your history of what you've done is important.